really going through the numbers so that the public can really understand in detail what we're talking about, and also bring in some healthcare workers to talk about what their experiences are right now and have been, so we can get a better sense. But just to give everybody a quick overview, our cases have been on the rise really since Halloween. Not just our cases, our percent positivity has gone up. I think today it's averaging about 3.5%. That's still really good, but it's triple what it was a month ago. So that's a pretty rapid rate of rise. We're testing a lot. We're not testing quite as much as we were when our universities were in session, but it's still far above what we need to do. So this rise in cases, this rise in percent positivity is not just because we're doing more tests. COVID is spreading more rapidly. It's everywhere, or at least we should presume it's everywhere. It is starting to affect our hospital capacity. I haven't seen the numbers today statewide, but I know they were very close to 1,400 COVID patients statewide yesterday. July, we peaked at 1,600. And if you remember July, most regions in the state were full. There was no elective surgery happening in most of them. They were transferring patients here. So we're really close. We're getting to that point again statewide. Already our hospitals now have number of transfers from other parts of the state that are saturated or very close to. And again, today we hit records nationwide for cases, hospitalizations, and deaths. So that means that every hospital system is under strain. There are no extra nurses that can come from one region where that's not a problem to our region. So it's not just that bed, it's people. We're in winter, which is usually a busy time for our hospitals, and we're already behind. So while we still do have capacity, it's getting less and less. We were appreciative that the governor saw this coming, and a few weeks ago rolled the entire state back. And I think it's a testament to New Orleans that really he rolled back very similar to where we already were. And we are one of the few parishes that right now is able to keep bars open. But unfortunately, the way we're seeing the spread happening is really quite fast. Our rate of transmission is sort of getting into that exponential spread, where it's not just sort of one case after the other. I'm sure most of you in your personal lives have heard about, well, this kid's class is quarantined, this friend of mine has it, somebody else has it, right? When we get to that level, we really only have a few days to stop the rise, to really double down on what we should be doing, which is wearing masks everywhere outside of our home. The CDC just came out with that language over the weekend. It was pretty strong language. That means if you're going to drop off groceries for your mom, you do not take your mask off and you do not come within 6 feet of mom, even if it's just for a minute or a few minutes. We're still seeing a lot of spread in casual settings where people start off trying to do the right thing, and then by the end of the evening, they've relaxed it. And then one person tests positive at the gathering of 4 or 5, and then everybody's got to quarantine, right? We're still seeing increased numbers in kids, which means a lot of classes are quarantined, a lot of teachers are quarantined. We've always said that we're going to prioritize in-person learning as much as possible because it really has been shown that that's the right approach. We've got 2 weeks to go to the end of the semester, so I'm hopeful that we can continue to do that. But what we do now determines whether your kids come back in January or they stay virtual, and we really don't want to do that. So we're looking at all this, and like I said, on Thursday I'm going to really go through sort of statistic by statistic. But as our cases stay elevated, as our percent positivity rises, we know if we get to 5%, things are triggered statewide, which means the bars will close indoors. There are certain hard stops that will happen. That might not be enough if we can't get it under control. And so we're constantly talking with the mayor and her team and providing recommendations that are coming from recommendations everywhere from the White House Task Force to Harvard to Johns Hopkins. They're all really well-established recommendations as to what we think we might need to do if we can't, get our numbers and our percent positivity down to keep our hospitals from getting to that breaking point. So that's just an overview. I'm happy to answer questions or talk about specifics.
WWL. So we know that there's sometimes a lag in the numbers coming in. So I know the city says they want to see a decrease in a week. Is that realistic, or when will we actually see the results from the actions taken right now?
Yeah, so our data comes from the Louisiana Department of Health, and yes, sometimes some of that data, depending on the turnaround time, is pretty quick. Some of it, I know that last week there was a big lag from one of the sites. I think it was a private testing site, reported a whole bunch of cases on one day that probably from the past couple of weeks. So there's definitely some noise there. We also are doing our community-based testing. We have access to that data almost in real time, and they really are very close, right? So I kind of use that as the canary in the coal mine. I look at the community-based data, and I can tell when things are starting to show up. We don't sort of get excited about one day, but what the trend has been is that cases are on the rise slowly. They haven't really stopped rising on average. And the percent positivity, it was coming back at 2% and then 3%. Now it's routinely about 4%. Regardless of when the tests were done, that's real. And so sustained days of that's a real pattern to us. And that's what we would be looking at. That's a good question. Dr. Fauci and others talk about the surge within a surge, right? We were already going up. I don't yet see sort of a dramatic spike, but right now is when we would start to be seeing a lot of those Thanksgiving cases, and certainly the Thanksgiving-related hospitalizations will be showing up in the next week. So if we start to really take off, it probably will be that Thanksgiving bump.
You talked about, even if you're going to go see your mom, you should still wear your mask and that sort of thing. What do you suggest people to be doing in their day-to-day life right now? Should they be staying mostly at home if they can? Can they go out to a restaurant? Can they go to a bar right now? What are your suggestions?
Yeah, you really have to think about everything you're doing and ask, is this going to result in me being quarantined? Even that sort of innocuous, night out with 2-3 friends, whether it's at their home, whether it's at a restaurant, if you are not really strictly staying apart and wearing your mask the whole time, understand that you're going to put yourself at risk and that group at risk. So the safest place to be is in your home. If you are choosing to go out, that mask has to be on all the time. And that means when you do choose to go to a restaurant, right, it's best if it's with your immediate family that you live with, because then you can take the mask off, you can eat, and it's fine. But, when you're not having that sip of your drink, the mask goes back on. And I know that that's weird, right? It's weird to sit at a table and take it off and sip and put the mask back on. But that's what we should be doing if we're going to be in situations with folks we don't live with.
I talked to some business owners. They're very anxious right now because they're afraid it's going to hurt their businesses. What do you recommend for them right now? What can you
Yeah,
tell them?
that's a devastating thing, right? We don't want to hurt. People's businesses have been so hurt by this. And with a little more patience and dedication and diligence in our personal lives, we don't have to. We've been really lucky. If you look at places all over the country, there are, they went from having businesses open to completely shut down. If you look at New York City, they've never really been able to reopen their businesses. And we've been lucky in that we have been able, and we appreciate everything that businesses are doing to take precautions to keep their employees safe and to make you have a safe experience when you're there. We ask for them sort of continued diligence to make sure their patrons are doing that, but that's my message to the public. If you want to keep your favorite restaurant open or your favorite wherever open, then you've got to act in your personal and professional life in a way that wouldn't result in them having to close.
Any other questions?
Hospitalization.
We have not, we're still not near that first wave, March, April.
No. So our peak in March, April, at least in New Orleans, was far higher than what it was. We were averaging, I think, at our peak, 450 cases a day. I haven't seen today's number, but we're between 100 and 150. That's a lot more than we've had since that peak. We definitely don't want to get to that peak because, nobody could handle that at this point. You're seeing a lot of places around the country at that peak, and that's why they're locking down completely. So we know we're not going to get there, right? We know a lot more than we did. We weren't wearing masks in March because we didn't know that it was a good idea. So we have the ability to stop this. We've done it before. We just have to really, it just takes a little more work and a little more diligence.
Thank you all.
Thanks, guys. See you later in the week.
Take care of your leg.
Thanks.